Good morning, ma'am, and my classmates. Myself, Simranpreet Kaur, and today Group 3 is going to discuss about the topic leadership and collaborative practices promoting quality, team effectiveness, and collaborative teamwork from 5.1 to 5.3. First is the professional practice. Firstly, the definition of professional practice. We all know that professional practice means the way an individual behaves in the workplace and provide care to the patient and family members with clear communication, collaboration, critical inquiry, and decision making. Next is the importance and benefits of professional practice. Firstly, professional practice ensures the well-being of patient. When the healthcare members follow proper protocol while dealing with patient with active listening, open communication, respecting patient, all these promotes wellness of patient. Next, professional practice creates positive impact on healthcare institutions and healthcare teams by maintaining collaborative relationship and clear line of communication. Teams enable themselves to share patient information and plan treatment more securely and effectively. Next is that by encouraging and maintaining a culture of respect, cooperation, collaboration, there are less chances of any kind of conflict between the team members. Next are the principles of professional practice. First principle is practice reasonable, responsible, and transparent behavior by avoiding harmful actions and following high ethical standards, also by addressing concern to patient and family members clearly. Second principle is acting without bias while advising and interviewing the patient and while making decision with patient and team members. Third principle is ensuring equitable access in delivering service to patient without any discrimination based on race, gender, sexual orientation, religion, nationality, disability, etc., and not expecting any kind of financial support or gifts from patient and family members. Fourth principle is complying with laws associated with local, state, and federal bodies. In case if any complaint occurs, then the team should respond it in a relevant way and counter to objections prudently. Fifth principle is protecting confidentiality of patient. All the personal information shared by the patient should be kept confidential by the team. So, this all was about professional practice. Next, Simranjit Kaur will discuss about quality assurance. Thank you.
Good morning, ma'am. My name is Simranjit Kaur and I am going to continue with quality assurance. Quality assurance is defined as identification, assessment, correction, and monitoring of all aspects related to patient care, which are designed to enhance positive health outcomes in a desirable period of time, or it also focused on prevention of mortality, that is death rate, morbidity, that is disease rate, disability, it is a state of being unable to use body parts properly, usually because of disease or injury. Malnutrition, it is a bad health by not having enough right kind of food, and development of current professional skills through continuous practice. Next are the principles of quality assurance. First, it is continuously emphasis on professional excellence and satisfaction at a reasonable cost. That is, Everyone, whether rich or poor, should able to take benefit of all health services. It continually insists on quality of life. It is continually updating by advancements in technology and science in order to provide current medical services. It developed learning goals related to improvement in the field of practice. Next are the purposes of quality assurance. First is to meet rising expectations of clients by providing good and safe quality of services. Second is to aware all hospital administration members about their deficiencies related to services they provide to patients and the positive factor behind these deficiencies. Providing in-service education in order to attain more competency in respective field. Elimination of medical errors by restricting undesirable procedures which are possible either by evaluation of procedures or practicing these procedures prior hand. Provide safe, ethical, and effective care to patient. Next are the types of quality assurance. For there are mainly two types of quality assurance. First is external, second is internal. External. It is usually done by official bodies or agencies to meet established standard at a given time. Example, external medical audit. And in internal, it is usually done by local assessors or peers. The main difference behind external and internal quality assurance is that in external, official bodies are from outside and in internal, official body members are from inside. Next is PDCA cycle of quality assurance in healthcare. PDCA in PDCA cycle, P means plan, that is to identify problem. D stands for do, that is to implement potential solutions. C stands for check, to find observations. A stands for act, implement or improve the X processes. With this, we have done quality assurance definition, their principles, purposes, types of quality assurance, and PDCA cycle. The next topic is role of leadership in create sportive and team-based work environment, which is done by my next group mate Kavita. Thank you.
Good morning, ma'am. Good morning, student. My name is Kavita, and today I am going to present the topic Role of Leadership in Creating Healthy, Supportive, and Team-Based Work Environment. In this, we should know about the leadership. The leadership is art of managing employee and extracting best out of them, which is done by a leader. So, the role of leader involves first planning, in which first is vision and mission. Visions are the long-term goals which are planned to achieve by a leader. And next, mission, how we can achieve that vision or that plans to work efficiently. Next is devices strategies. Division of strategies involve the crafting of strategies to putting the vision into action. And next is goals and objectives. Goals and objectives are made to implement the plan. So this also involves the long-term goals and short-term goals. Next is organizing. Second one, organizing. So this involves the organizing design. Organizing design is step-by-step methodology. Step-by-step methodology which involve whole process and the structure of the work. Next is communication. Communication is the key characteristic of a good leader, which involves the clear, simple and direct communication which shares information and also give positive ideas. Next is networking. Networking involves a network of a whole team member, which in the healthcare profession, all the caregiver involved in the networking. This helps to reduce the conflict and also help to resolve the problem easily. Next, third one is directing. In directing, first is group and team formation. The leader should form the group or team in which the team member, each and every team member, listen to the leader attentively and work efficiently. Next is empowering people. Empowering people involves the assignment of the work to a particular person in the work field. Next is motivation. Motivation involves encouragement. Next is rewards and appreciation. Also, a leader can act as a role model to motivate their team member. As always, motivation pushes the employee to work hard. Next is controlling. Fourth one and last one is controlling. It involves the give sense of accomplishment. Sense of accomplishment is only occurs when the employee and the patient both are satisfied, and this will also help to increase the quality of care in the health field. Next is the strategizing human resources. Strategic human resources involves all the humans resources such as from physician, nurses and paramedical staff to trainees. All the human resources should be involved in the strategy and also take help of the physical resources. Next is the role of leadership in creating healthy, sportive and team-based work environment. It involves the leadership. A leader should acquire the qualities which involve motivation, competence, skills, responsibility, communication, power, support and teamwork. Next is role of leadership. It involves the building collaboration. The collaboration involves the engaging of all the team members in the working process. Each and every person should involve or should take action in the accomplishment of the planned criteria. Next is the coach team member. Coaching team member involves the assessing the team performance, giving them feedback and also anticipating the work ethics. This also involves the demonstrating the skills to the team members. Next is the development of team strength and improve weaknesses. Team strength can be developed by assigning the work according to the ability of the person. The person who excels in the particular field should be assigned to that field. Next, improvement of weaknesses can also be can only done by giving the appropriate step to minimize the weaknesses. Next is identifying team goals and monitor team progress. By identifying team goals, it involves what the team wants to do and what the team plans to do for the care of patient. And also monitoring the team progress means assessing the team progress by the leader. These two things help in the collaborative leadership. Next is to resolve conflict. As we all know, in the healthcare team, different professions, and the person have different profession, and they all have different traits and personality. So oftenly conflict may arise. The responsibility of leader is to resolve the conflict before it turns into a dispute. Next is the organizing team initiative. Leader can be organizing initiative by organizing team meetings and discussions. In discussion and team meeting, the team members can ask about their needs and also can tell about the new ideas and innovative ideas they kept in their mind. Next is meaningful recognition. Meaningful recognition involves it involves that each and every person in the healthcare team or any teamwork is important, and they should have a feeling of valued and essential in each team. So the meaningful recognition lead to a healthy work environment. Next is building trust, inspiration, and helping co-worker. Trust building and giving inspiration and helping other workers is a main key for the supportive work environment. It helps in the support of each and every person in the team. So this is all about the role of leadership in the work environment. Thank you.
Good morning, ma'am, and my dear friends. My name is Devinder Kaur. Today, I would like to explain the topic that is role of leader in leading interprofessional collaboration. Firstly, I would like to define the term interprofessional collaboration. Interprofessional collaboration means a participatory, collaboratory, and coordinated approach between a healthcare provider and a client to share decision making which is related to health and social issue. Interprofessional collaboration occurs when learner, patient, families, and community work together and maintain interprofessional working relationship with each other. To understand the term teamwork in a better way, I would like to play a video on collaboration. Here is video of collaboration. Next is role of leader. Leader play a essential role in each and every team. Leader can make or mar the organization with his or her skills. Quality of good leader. Good leader should be a punctual. He is always on time. He should be participatory. He must participate in all team activities. Leader always give example to their team members to promote the work performance and to understand his or her own point of view. Next is role of leader in interprofessional collaboration. To lead the interprofessional collaboration, leader should, firstly, he should share vision and mission statement with team members. Here, vision means what we want to achieve in future, and mission means is current objective. Next is leader must formulate and articulate goal and strategies which is easily understandable and easy to achieve. My next point is leader should encourage and engage participation of all healthcare personnel in decision making. Next is leader should recognize and ensure equitable distribution of work between the healthcare personnel without any discrimination like color, caste, and religion. Next is leader should address the conflict as soon as it occurs between the employees and try to resolve the situation before it becomes serious and try to boost the morale of team. Next is leader always appreciate and recognize the team member contribution. He should give pizza parties and free movie ticket to team members who work in a better way. It is a good way to promote and appreciate the team member performance. Next is leader should always accountable for the team results, whether it is good or bad. He always give credit where credit is due and take the responsibility for blame whenever necessary. Next is leader should promote the team spirit and cooperate with all healthcare personnel. Next topic will be explained by Harjinder, that is influence of leadership on team effectiveness.
Good morning, ma'am, and my dear friends. My name is Harjinder Kaur, and I'm going to continue on the topic Impact of a Leader on Team Effectiveness. A leader might influence teamwork either in a good way or a bad way. It clearly depends on his or her leadership skills and quality traits. The positive effect that a leader have on team with his or her good leadership skills are: first point, the team clearly understand their assigned duties and responsibilities without any confusion, and they fulfill it on time to ensure patient quality care. The next point, the team members have good team spirits and work collaboratively to achieve the common goals. A leader also encourages his or her team to have a good, healthy work environment and good interprofessional relationships. Next point, a leader also breaks down silos and competition in between team members and also prevent them from holding any information that can increase patient safety errors or poor work performance. The next point, a leader has to enhance work performance and decrease medical errors in the hospital, such as delayed diagnosis, delayed treatment, medication errors. To overcome these barriers, he communicate effectively with his or her team. In the next slide, contradict to good leader, a bad leader can adversely affect his or her team work due to lack of responsibilities, mistrust, lack of respect among their team members. Next, poor poor communication and poor conflict management skills of a leader can also lead to negative outcomes such as uh, decreased patient satisfaction, medical errors, increased medical errors, poor quality care, and decreased productivity morale. The next point, the partiality of a leader can also increase information hoarding and silo mentality in between team members, which will result in poor work performance. In the next slide, we can see a figure which shows difference between a bad leader and a good leader. A bad leader acts as a boss and does not work collaboratively with his or her team, whereas a good leader helps his or her team to work collaboratively and motivates them to achieve the goal. Now it's time for the recapitalization. Today we discussed about professional practice, its definition, importance and benefits, principles. Next we learned quality assurance, its definition, their principles, their purpose, types, and PDCA of quality cycle in healthcare. Next we learned role of leadership in creating healthy, supportive and team-based work environment, role of leader and role of leadership. Next we learn interprofessional collaboration, its definition and effective video for understanding collaboration, role of leader and role of leadership in interprofessional collaboration. Next we learn influence of leadership on team effectiveness, positive fact of good leader and negative fact of a bad leader. Next figure, next references, next. Thank you for watching the video.